Now to the numbers. Texas sets a new record again for COVID-19 deaths in a single day with 129. But we're still seeing far fewer deaths than states that were hit hard earlier in this pandemic, like New York. Chris Costa is putting it into perspective tonight.
Compare the populations of New York and Texas. Texas, almost 29 million. New York, almost 19.5 million. But so far through this pandemic, 25,000 plus New Yorkers have died. In Texas, 3,500 have died. So why have Texas doctors been able to keep more patients alive? One of those reasons is that some of those early hard-hit states are sharing lessons learned.
We've gotten a lot of help from our colleagues in New York and Washington, both technical expertise and my understanding is that some of the nurses that are coming to Texas are actually coming from New York. And the New England states.
Doctors in Houston have told reporters they've reached out to colleagues in New York for advice, like avoiding using ventilators on coronavirus patients when possible, because sometimes it made things worse. Healthcare workers in the two cities also sharing information, like research that shows that the antiviral drug remdesivir is effective. About that drug, a Houston Methodist Hospital spokesperson says they're awaiting their next resupply from the federal government any day now, but they haven't been told how many doses they'll get. Thursday, Methodist had 690 COVID-19 patients across its 7-location hospital system. That includes all patients who tested positive, plus those who are now negative but haven't recovered enough to leave the hospital. Their peak for COVID patients so far, 712 this past Sunday, July 12th. A small, potential good sign that we'll be watching. In Houston, Chris Costa, KHOU 11 News.